Professor, what are your thoughts, sir, on these new restrictions that were just introduced by the COVID cabinet? Are they good enough? Do they go far enough to make a real difference in this outbreak?
Well, we've seen a very rapid increase in the number of cases, and therefore we really think that the most effective way to prevent lockdown is going to be by vaccinating as many people, older persons with booster shots and younger persons who are not yet vaccinated with the initial dose.
I want to ask about the campaign to vaccinate the eligible unvaccinated. It's 1 million Israelis. It's been 1 million Israelis for almost 6 months now. We talk about the need to get them vaccinated. They're not getting vaccinated. It's a small trickle every day, but we're talking about 1 million people who've been eligible for almost a half year. They're not going to do it. So if they don't, do we go to a lockdown? Should we plan, do you think, realistically on a high holidays lockdown?
Yeah, well, what the government is seeing is such a sharp increase in the number of cases. And what we're experiencing in our hospitals, a sharp increase in the number of hospitalized patients in severe disease. And if this rate of increase in cases continues, there's not going to be any other choice but lockdown to relieve the pressure of the hospitalization system. For now, I think there's still time to turn the tide, but it's really dependent on individual persons' personal responsibility. And vaccination is a major part of it. And the other part is, of course, observing all restrictions, using masks and avoiding crowds. And if you're not feeling well, then staying home and getting tested.
What are your thoughts, Professor, on the science behind opening schools here in Israel in 3 weeks? Hundreds of thousands of kids, they're ineligible. They can't get vaccinated. They're scheduled to go back into packed classrooms. Is that safe now?
Well, we do think that COVID overall is not a very, very dangerous disease in kids, in young children. And so for kids, it may not be unsafe, or I would say it's safe for kids to go back to school. It's much more dangerous for children to stay home for weeks and months, as we've seen in the last several years. However, the country needs to be protected well enough, and adults from risk group need to be vaccinated in order for, if the disease rates rise with the return to school, then these people are going to be protected by the vaccine.
Do you think that we're now, one of the restrictions is returning to outdoor masks for big crowds? We have 2 years now almost of data regarding COVID. Do you think from a science and public health standpoint, do outdoor masks make sense? Will that have an impact?
Well, we know that Delta variant is highly contagious, and there are now reports emerged from various parts in the world. There's now a report from the CDC about mass gatherings that occurred in Massachusetts, and the infection rates were exceptionally high for Delta variant. So until we have concrete data, we want to err on the side of caution, and therefore when you have a very large crowd outdoors, there's still potential risk for spread with such a contagious virus.
Professor, thank you so much for your time here on i24 News. Great to have your perspective.